Hello, my name is Sophia Abdallah. This is six SPCE 683, Section 808, Dr. Bafa, and it is October 20th, 2024. This is case study 2. Client background. So let's just talk about the client background again. My client is 4 years old. We're going to call her Somi. Her diagnosis is autism spectrum disorder ASD or and attention deficit hyperactive disorder ADHD. Behaviors of concern are screaming and tantrums. Some other areas of concern are communication skills, adaptive skills, motor skills, social skills. Her communication level is that she's nonverbal to minimum verbal, and she's been in the clinic for 4 weeks now. So, behavior targets. Screaming and tantrum. So, for the definition of this behavior of screaming is defined as any loud vocalization above normal speaking volume that lasts at least 1 second. The function for her is access to tangibles and escape from demands. Some examples of that looks like her saying ah, screaming no when a demand is placed, screaming ah when a client wants an item. Some non examples include the child singing loudly and the child saying ouch loudly after getting hurt. For tantrums, the definition of behaviors is any occurrence of the client engaging in two or more behaviors simultaneously, including but not limited to flopping, screaming, crying, elopement, or protesting for a duration longer than 5 seconds. The function is also access to tangibles and escape from demands. Some examples are placing a demand and the client begins to engage in loud vocalizations with tears or without tears and falls to the floor, removing any item from leaving a location, and then she begins to engage in loud vocalizations with or without tears. Some non examples is playing on the swing, up and down, and engaging in loud vocalization with tears. And we're going to be focusing on the, go back. Oh, okay, I'm sorry about that. So we're going to be focusing on screaming. So for interventions to use, we're going to be using differential reinforcement of alternative behaviors. So replacement behaviors. For escape, Somi will be taught to request a break from the environment demands using a PEX board. Somi will also be taught to accept certain demands. For access, Somi will be taught to request items activities using a PEX board, and Somi will be also taught to wait for an item that is not immediately available and tolerate being denied access to an unavailable item. Some antecedent modifications. For escape, we're going to be teaching Somi priming. Somi will be given timers or warnings of transition or when a demand will be placed. Somi will also be provided with high levels of reinforcement for complying with demands that have been placed. For access, Somi will be provided with a high number of opportunities to request for desired activities or items. Somi will be provided with warnings if an item may be unavailable and provided with an alternative that she may like and that's available instead. And there will be a high number of opportunities to practice waiting and accepting no will be provided. Okay, now we're going to talk about consequence-based strategies. So for escape, when appropriate, we're going to honor Somi's demands for more time or my way using her PEX board. We're going to teach FCT, so we're going to model for her. You can tell me my way by using a PEX board. We're going to gesture to the PEX board. And after the PEX board is given, we're going to immediately reinforce by honoring demand. If you're holding a boundary and you have more time or breaks are not possible at that time, follow the protocol for holding a boundary. So follow through with demand, block access to any items she's engaging with, and when refusing, use Premack principle. Use empathetic statements when she's upset and reduce response effort or offer choices of available options. For access, you're going to provide empathetic statements like, I'm sorry you're upset, buddy. I know you love this, and accepting no, and offer other options that are available. And we're also use FCT. So when maladaptive behaviors begin occurring, immediately prompt Somi to engage in FCT using her PEX board, modeling the function of request using PEX board, and require Somi to give the PEX and immediately reinforce the FCT. Okay, rationale. These interventions aim to reduce screaming behaviors in a 4-year-old nonverbal child, Somi, by teaching alternative communication skills and coping strategies for handling challenging situations. The primary approach involves differential reinforcement of alternative behaviors, DRA, where the child is taught to request breaks and ask for items using a PEX board as a functional communication alternative to problem behaviors. This helps the child access desired outcomes in more appropriate way. Additionally, teaching the clients to tolerate waiting, accepting denied requests, and complying with demands gradually builds their coping skills and reduces reliance on maladaptive behaviors. And the antecedent modifications like priming it with visual timers and providing frequent reinforcement for complying with demands aim to prevent problem behaviors by preparing the child for transitions and making desirable behaviors more rewarding. Functional communication training further supports this by prompting the child to use specific pecs to communicate needs, which are immediately reinforced to strengthen these new skills. Empathetic statements and offering choices help de-escalate frustration, while strategies like the PREMAC principle motivate compliance by linking preferred activities with task compliances. Together, these interventions address the function of the child's behavior to promote to promote functional communication and adaptive responses. Okay. So, evidence based. These interventions are considered evidence based because they are grounded in principles of ABA, which has strong research foundation demonstrating um, effectiveness in managing challenging behaviors and teaching new skills, especially in children with autism. So, for these differential reinforcement of alternative behavior (DRA), this approach has been widely supported by research, as it is an effective method for reducing problem behaviors by reinforcing appropriate alternatives. Studies show that when a child is taught to use functional communication, such as requesting a break or asking for an item, problem behaviors that previously served these functions decrease because the alternative behavior becomes more effective and efficient in meeting the child's needs. Functional communication training (FCT). FCT is a well established evidence based intervention for teaching individuals to replace problem behaviors with communicative responses. By reinforcing communication that serves the same function as maladaptive behaviors such as escape or access to tangibles, FCT effectively reduces the occurrence of problem behaviors and supports the development of appropriate communication skills. Antecedent modifications such as priming and reinforcement. Interventions like priming and using visuals supports are backed by research indicating that preparing for a child for transitions and demands reduces anxiety and the likelihood of escape related behaviors. Similarly, providing reinforcement for following demands aligns with the principle that behaviors that are consistently rewarded are more likely to be repeated. So, how this relates to the BACB task list. So, for G2, we use DRA to find replacement behaviors. For G19, we're teaching the child to request items or breaks for promoting functional communication skills and increasing verbal behavior. For B12, by providing cues for transition and task demands, stimulus control is established over the child's behavior, helping to reduce problem behaviors. For H2, the antecedent modifications are selected based on the functional assessment results, addressing the identified functions of escape and access to tangibles. For F6, the interventions are based on the functional assessment of behavior, which identify the functions of escape and access to tangibles. And then these are our references. Thank you.